The developmental management of middle childhood. Middle childhood is the school-age child, from ages 6 to 9 years of age. The school-age child is a time when they're busy, active, and very curious. They have advanced physical activities. They're a master at reading, writing, math, and science, and they become more skilled socially. It is the nurse practitioner's responsibility to know normal development of the school-age child. This development will be assessed through history taking, physical exam, and observation during the visit. For physical development, growth spurts occur. The prepubertal child gains an average of 2 inches and about 5 to 7 pounds a year. They are extremely curious about the changes happening to their body. Your textbook has a great chart overviewing the typical physical developments of the middle childhood. For their gross motor skills, they're more refined, so they're able to run and jump and climb and hop and skip faster and stronger. For fine motor skills, they have improved dexterity, allow them to use scissors and writing tools, dressing themselves, and drawing. When asking for a history, you want to ask about their school performance, their physical activity, their self-care. You want to evaluate how they're doing in PE. Do they have any issues with strength or coordination? Or do they have any issues with mobility? For communication and language development, the school-age child's speech should be fully intelligible by age 6 years. Stuttering should also be resolved by the school age. However, they still may stutter occasionally when they get excited, and it might be just the first word or the first few words of the sentence. But this is okay, and as long as it's not consistent and all the time, there's no need to worry. When gathering a history, the nurse practitioner should ask about school performance. If a language delay is identified, a 504 plan or IEP plan should be requested and kept in the records. During your physical exam, you want to speak directly to the child, listening for articulation and sentence structure and grammar. Speech and language disorders are among the most common developmental delays in the school-age child. So the nurse practitioner should always evaluate improvements and changes in communication and language development. With social and emotional development, as early as 7 years of age, some children care more about what their friends think and their opinions than their parents. Around 10 years of age, it's that special friend phase. They have an intense attachment to the same gender child. At this age, they can begin talking on the phone, texting, and even using social media. When gathering a history, the nurse practitioner wants to ask about friends. What do they do on the weekends or after school? You want to make sure that they have a trusted adult that they can talk to. You also want to conduct a psychosocial screening and assess any life stressors, depression, anxiety, self-esteem issues. And you want to make sure you look at the caregiver and child relationship. When it comes to the school-age child's body image, they're very curious about their bodies and they're sensitive to others. This is the age where modesty is really big. So remember when you're doing your physical exam to try to keep them covered up as much as possible. When it comes to coping skills of the school-age child, their ability to manage feelings has improved, but it is limited. They should have impulse control by now, but this is a time that stressors come into play, such as violence and bullying and divorce. So you always want to make sure you assess for lifetime stressors when gathering your history. When it comes to their cognitive development, this is Piaget's transition from pre-operational to intuitive thinking. So I have it listed here for you to review and read. Cognitively now, the school-age child is able to learn about the world. Others' viewpoints and values can be considered and understood. They are able to focus on more than one aspect of a problem, and they can use logical thinking. To assess the school-age child's cognitive development, when gathering a history, you want to ask about school performance. When it comes to your physical exam, you want to engage the child in conversation. You want to ask them questions and have them follow instructions with increasing complexity. During the well child visit of a school-age child, you want to conduct your screenings and you want to conduct a developmental surveillance, focusing on the physical, nutritional, neurodevelopmental, psychosocial, emotional, and behavioral aspects of the child. The nurse practitioner will always want to provide anticipatory guidance, but a big thing at this age is to evaluate the family's ability to help the child separate and become more independent. Your textbook has a list of developmental screening tools used for the school-age child. You will want to get the parents, teachers, and child's perception using these tools. For the physical development or the physical exam, you will want to continue to measure growth patterns, paying close attention to the BMI. This is also the age that you want to begin Tanner staging. You will need to assess the strength and the coordination for the motor skill development, and for communication and language development, you want to assess the child's articulation, vocabulary, grammar, and their social interactions. For the child's social and emotional development, you'll want to assess any life stressors. You also want to assess their success in making friends and in peer relationships. For cognitive development, you want to inquire about school performance. If a problem is found on assessment, then you will need to perform diagnostic studies for further evaluation. The next few slides list the Bright Futures universal screenings and the selective screenings for the school-age child. When it comes to anticipatory guidance, the school age is the age when the child becomes more independent and spends a little bit more time away from the family. So when it comes to parent development, you want to assess how the child is dealing, or how the parent is dealing with the child's newfound freedom. You also want to make parents aware of the risk associated with their child's newfound freedom. When it comes to regulation and sleep-wake patterns, you want to counsel the family on keeping routines and traditions, and how you can help adjust the family to the child's new school schedules and routines. For strength and motor coordination, you always want to encourage physical activity and some participation in exercise. The child should own their own activity and make it fun. We want to encourage hobbies and fitness to increase motor skills. When it comes to nutrition, the nurse practitioner should know that pediatric obesity is increasing. Also, that deficiencies in important vitamins and minerals are on the rise. The school-age child is more independent. Therefore, they have more of a say in their food choices and eating habits. The nurse practitioner should inquire and counsel the family about healthy eating habits. When it comes to self-care, oral health is important. It's during this age that the children begin shedding their primary teeth and growing adult teeth. So the nurse practitioner will need to stress to the patient and families the need to encourage brushing, flossing, and limiting sugary snacks and drinks. When it comes to safety of the school-age child, parents should be counseled on teaching the child survival skills. That is, knowing their full name, knowing their parents' full name, their phone number, address, and how to use 911. You want to encourage required safety equipment such as helmets when riding bikes and skateboards. When it comes to car safety, always wear their seatbelt, or if they're under the appropriate age or height, to always be in a booster seat. Encourage sunscreen and how to swim. And you always want to encourage parents to monitor their child's screen time and social media, and to keep firearms unloaded and locked. Anticipatory guidance for communication and language is, again, to read. Read often to your child, or have your child read out loud to you. You want to encourage them to maybe keep a journal or write letters to discuss their feelings, to play word games, to talk and actively listen to the child. And you always want to limit the screen time to 1 to 2 hours a day. Anticipatory guidance for social and emotional growth include monitoring the child's activities or in allowing them to set goals. You always want to provide positive expressions of love, concern, and pride. Set clear rules and expectations. You want to guidance them on how to handle their feelings of aggression and anger. Parents will want to talk to their children about how to handle these feelings and to come to some sort of conflict resolution. When it comes to cognitive and environmental stimulation, again, we want to encourage reading, establish a time to do homework. We want to volunteer at the child's school, recognize academic achievements, and provide opportunities for complex skills. A common developmental issue for the school-age child is the lack of school readiness. It's estimated that about 30% of 5-year-olds are not ready to start school. This percentage increases to about 50% of children who are not ready to start school if they have low socioeconomic status. School readiness is not all about how much the child knows. There are also important social requirements needed for school readiness. Skills needed for school include the child must be able to perform self-care, interact with new people, be away from family for periods of time, and have self-control. When taking a history, it is important for the nurse practitioner to ask these specific questions to find out if the child is ready for school. When assessing for school readiness, the nurse practitioner can perform a normal physical exam. You will want to focus more on neurological functions, such as sensory, cognitive, and language abilities. And you want to include in there if you see any symptoms of anxiety or depression. Diagnostic studies should include hearing and vision screenings. The management includes teach parents to assist with skills, colors, and numbers. The child may want to visit the school and meet the teacher. Maybe you have a rehearsal day where you plan out activities that they would do in school. You want to always see if there's any community or school resources available for school readiness and encourage starting with a developmental group. Another common developmental issue for the school-age child is a learning problem. Learning problems can be identified in a history, physical exam, or diagnostic studies. It is extremely important to inquire about school performance in the school-age child. Once information is obtained from the history and the physical and diagnostic studies, a differential list can be started. Is it a hearing or a vision problem? Is there some form of mental retardation? Is there a cognitive or a speech delay? Is it ADHD, depression, autism? All of these should be included in your differential list. And of course, management is early diagnosis and a referral. School refusal or school phobia is another common developmental issue of the school-age child. Here is a description of school refusal or school phobia. The diagnosis includes the 5 criteria: physical complaints of stomach ache, headache, dizziness, fatigue, or a combination of a few of the symptoms. Management of school phobia is supportive. You want to support attendance at school. You want to notify school personnel that there is an issue. And you want to assess the home situation and refer if necessary. Similar to school phobia is recurrent physical symptoms, which is another common developmental issue of the school-age child. Though it doesn't have anything to do with school, there is recurrent symptoms without medical explanation. Clinical findings in your history will be vague, intermittent symptoms with normal function in between the episodes. Here's a list of differentials that could be associated with these recurrent physical symptoms. Management about this is not to medicalize the problem. You don't want to do a lot of tests and a lot of things that are going to make the family worry. you want to make sure that the history and physical do point to a specific symptom. Here are a list of red flags for the school-age child. If any of these are identified, further evaluation is warranted. Here's a list of motor skills and cognitive and perceptual red flags for the school-age child. And here listed is communication and language and social and emotional skills red flag for the school-age child.